The best part of my job is when I am one-on-one with somebody in the exam room, getting to know them, talking about their concerns and their questions, and then just helping them find solutions, helping them navigate a path that is going to help them feel better and live better optimally. If I'm talking to other practitioners, I would say, yeah, don't give up. Find something else, because healthcare is wonderful, and fortunately there are other direct primary care clinics popping up also. But I would certainly advocate for something like this to anybody. And for patients, yeah, there are better solutions, definitely. There are ways that you can feel better, and sometimes it's just thinking outside the box and getting outside of the system. One of the things I love about working with people is just the education piece of it, and really talking about, okay, you're having these symptoms, but where are these symptoms coming from? And then you figure that out, and then you really know how to help somebody. But when somebody comes in and you have 15 minutes to talk with them, the quickest thing you can do to maybe help them feel better is give them a prescription. And so then they're just taking more and more medicine, and then and not necessarily getting to the root of the problem or even really feeling better. So time is a huge, huge one. And that also just gives you a chance to get to know people. And that's ultimately important, because if you get to know them, you build a relationship, you build trust, and then everybody's more confident in moving forward together. So that's big. I also just love the fact that we don't have to deal with health insurance companies so much, a little bit here and there with prescriptions, but really, so often I would try to do something for a patient, whether it was getting them a blood sugar monitor or an inhaler for their asthma, or even an antibiotic, and then you get a message back from the pharmacy, well, this isn't covered because their insurance. And there have been a few times with inhalers in particular where I'll send 3 different prescriptions to the pharmacy, and finally I just have to tell the patient, will you call your insurance and find out what they will cover for you? So it's the insurance company that often decides what you can and can't do, versus the individual working with their practitioner. So that's a really big difference. I think also our relationships in the clinic is invaluable to me, the friendships and the people that I work with, and that teamwork approach that I haven't always experienced with other places. So it's a world of difference.